Om Swastiastu. Assalamualaikum warahmatullahi wabarakatuh. Shalom, Namo Buddhaya. Salam sejahtera untuk kita semua. Today, we from SGD B3 will present our student project. The topic of our student project is Role of Intravenous Pyelography in Urinary System Disorder. And here is our members. The introduction of this topic will be presented by my friend. Thank you.
And my name is Urinary, name 053. We'll start now. The first one is the background. The kidney, ureter, bladder, and urethra make up the urinary system, which is responsible for eliminating waste products, regulating ions, blood pressure, and many more. And the kidney filters blood, allowing waste to pass down to the ureter, to the bladder, and as urine. And there are many urinary diseases, and some might be specific and some might not. And thus, we need to provide an imaging, which is crucial in defining a diagnosis and treatment approach. Next. The urinary system disorder can be evaluated using many modalities such as CT scans, MRI, IVP, or intravenous pyelography, USG, and many more. And in order to diagnose most of the urinary system disorder, IVP and CT scans are often looked for specific kidney and ureter bladder symptoms. While IVP pyelogram can be helpful in determining the upper tract urinary blockage, it may be ineffective in individuals with significantly reduced renal function. And they say that the specificity and the sensitivity of IVP is 92 to 94%, and the sensitivity 64 to 87%. And an IVP assists to move the stone through the ureter by providing a significant osmotic diuretic impact in acute colic. Despite so, some researchers argue that considering alternative techniques have often given better anatomical and physiological insights, IVP are currently infrequently utilized to examine the urinary system. Next, these are the formulation of the problems. There are 10 of them. And next, this is the purpose, the general purpose, and the specific purpose. Next will be continued by my friend.
My name is Cynthia Sasudana. With the last reading number 223, I'll be presenting the benefit and also the definition. This is for the benefit. Next. And for the definition, intravenous pyelography is an X-ray examination that uses iodized contrast to assess a person's urinary system. The contrast used will be injected through the patients, and after the contrast is inserted, the doctor can assess through X-ray examination whether there are disturbances in the anatomical system and function of several organs included in the urinary systems. Thank you.
My name is Johanna Kori. My student number is 107. Before doing the intravenous pyelogram, there are some things that the patients have to prepare, and the doctor will give the patients detailed instructions about it. First, on the night before, the patients will likely be instructed not to drink and eat after midnight, and patients are also asked to take a mild laxative in liquid or pill form. Besides, patients should tell about medication or therapies they are taking, at least of any allergies. On the examination day, before it starts, the patients are asked to remove all of their accessories, such as jewelry, watch, eyeglasses, removable dental appliances, or any metal objects which might impair the X-ray images. And then the patients will ask to empty his bladder, and then the patient will change into a special examination gown.
My name is Gidebrandu Gradena with student number 193. Procedure. A set of preliminary images is needed before contrast administration. This imaging is an important step and may not be missed. Additional oblique images can also be supporting. First is administration of contrast bolus. It is injected into a vein in arm. After 1 to 3 minutes of contrast administration, nephrographic image should have been obtained. Then, a kidney ureter bladder radiograph should follow 5 minutes after contrast administration. After getting a kidney ureter bladder radiograph, abdominal compression should be immediately applied. 5 minutes after abdominal compression, get pyelographic images during early bladder feeding. After the release of abdominal compression, get a kidney ureter bladder radiograph and fluoroscopic spot images of ureters. Last, get the radiographic images of the bladder. Thank you.
Hello, my name is Aurelius Fulbertus Novito, and I will continue the presentation about indications and contraindications. Intravenous pyelogram is used in investigations for flank pain. It can also be used if the patient has hematuria and other lower back pain, which is considered to be related to kidney injury. Other conditions that can be diagnosed using intravenous pyelogram include kidney stones, congenital urinary tract disorders, enlarged prostate, kidney cysts, urinary calculi, scarring, strictures, neoplasms, tumors, and traumas of the urinary tract. Intravenous pyelograms should not be considered in patients with adverse reaction to the contrast material, as it can cause unwanted anaphylactic shock. In pregnant patients, extra care should be used to shield the fetus from unintended radiation. Intravenous pyelogram should also be used with caution in patients with kidney failure, as the use of contrast materials can cause kidney failure. That's all from me. The presentation will be continued by my friend. Thank you.
Hello, my name is Andrea Ivana with the student digit number of 101, and now I'll explain about the possible diagnosis. Intravenous pyelography may confirm diagnosis with minimal error when systematic assessment of the result has been done. Some aspects of the pyelogram that should be taken in an assessment, such as in the kidneys, are the size, the position, the vertical axis, renal contour and symmetry, renal parenchyma and parenchymal thickening, scarring of the parenchyma, calcical distortion, cyst, double contouring of the renal parenchyma, rounding of the fornical margins, loss of papillary impression, clubbing of calyces, abortive calyces, and aberrant papillae. For the ureters, things that should be taken in assessments are symmetry as well as the medial and lateral deviation of both the ureters, ureteral obstruction, obstructive and non-obstructive dilatation of the ureters, and asymmetry of the ureteral caliber. For the urinary bladder, things that should be taken in assessments are the physiologic distension, position of the bladder wall thickening and irregularity of the lumen, the contour abnormalities and diverticule, and lastly the neoplasms. That's all for the possible diagnosis. Next will be explained by my friend. Thank you.
Okay, first my name Gabriel is the number 169. I want to tell about the result interpretation. So this assessment of the kidney will assess the blood flow to the kidney, parenchymal excretory function, and the presence of the obstruction, position, regular appearance, venous outflow, and the size of the kidney. For the ureters, we can evaluate based on regular appearance, size, smooth symmetricity. And the bladder, we can assess for its texture appearance, regularly and complete voiding. Before that, as some kidney abnormalities that can occur, for example, hydronephrosis, infection, kidney tumor abnormalities due to congenital problems such as presence of supernumerary kidney, horseshoe kidney, and double system kidney. In the ureter abnormalities that can occur, for example, the presence of diverticula, hydroureter, kinking ureter, abnormalities in the bladder, such as presence of diverticula, indentation of filling defects. In the picture of the kidney that have mild obstruction, will appear a dull picture and a flat picture. It will appear in moderate obstruction. The presence of the parenchyma is getting thinner, or presence of the clubbing sign is a sign of the severe obstruction. And the presence of the contour abnormalities occurs due to change thickness in the parenchyma. In certain cases, such as diverticula, there will be evacuation in contrast, and other symptoms related to the problem due to tuberculosis in urinary system are often found with mold-eaten calyx, sawtooth appearance in the ureter, pipe stem, and in the ureter and thimble bladder. Special signs such as cobra head in the case of the ureter cell, or intravenous pyelogram in some case of the malignancy, whether benign or malignant. You will see a phantom calyx or with filling defect. In the cases of the intestinal obstruction, the contrast is retained in the certain column. Medial deviation will occur if there is a separation of less than 5 cm between the ureters. Fibrosis can often cause a bladder that look narrow and tiny, image during bladder filling can also come from bladder problems. In such case, the presence of the delayed passage should be noted until the degree of obstruction can be determined. If the bladder can be dilated sufficiently, evaluation is done with image obtained, but if the disease is present, image to look for obstruction can perform oblique or post void to better evaluate the bladder.
My name is Krisyu Alvani Abson with last reading number is 118. Intravenous pyelography is generally safe, which complications are rare, but there are some risks of complications such as allergic reaction. In some conditions, injected contrast material can cause metallic taste in mouth, hips, skin rash, nausea, and itching. Sometimes, severe reactions happen such as low blood pressure, breathing difficulty, sudden full body allergic reaction or anaphylactic shock, and even worse, cardiac arrest. Late anaphylactic reaction to iodinated contrast can occur in patients in 1 until 24 hours after receive intravenous retrograde pyelogram. Clinical manifestation can be found such as tongue swelling, difficulty breathing, neck and face edema. It can cause airway obstruction and resulting in stridor and hypoxia. Bilateral retrograde pyelography can lead to rare complications such as reflex anuria and acute kidney injury. Anuria occurs due to edema in upper urinary tract. It can develop into acute kidney injury with symptoms including severe flank pain and persistent bilateral backache and lower abdominal pain. Caused by mechanical obstruction, backflow of contrast materials from renal pelvis to tubules can cause overload pressure, occlusion in kidneys, and decreased renal blood flow.
Hi, my name is Jerry and my student number is 094. So actually, the intravenous pyelogram test is generally safe to use and the complications that arise are also rare. And the main risk of the intravenous pyelogram test mostly lies in the reaction to the dye used. Some of the risk factors that can cause more severe reactions are diabetes mellitus, congestive heart failure, and history of allergic reaction. Next slide. X-ray dye injections can cause side effects or minor reactions such as a feeling of foam or flushing, a metallic taste in the mouth, nausea, vomiting, and itching or hives. In very rare cases, the reactions can be more severe, like struggling to breathe, extremely low blood pressure, swelling of the mouth or throat, cardiac arrest, and anaphylactic shock. If an allergic reaction is found, it can be treated using antihistamine. Next slide. If at the time of the intravenous pyelogram test, the patient is pregnant or suspect that she might be pregnant, she must notify the doctor before undergoing the procedure. Even if the risk to the unborn baby is small, the doctor will consider whether it is better to wait or use other imaging tests. It is possible that the risk that can also occur is cancer due to excessive radiation exposure. However, the amount of radiation used during intravenous pyelogram test is low-level radiation, so the risk of damage to cells in the body is very low.
My name is Claudia Felicia Limanda with NIM number 19025111058. Now I will explain the advantage of IVP compared to other diagnostic methods. First, it is minimally invasive but also effective. Second, it has little side effects and radiation. Third, it is easy to visualize due to the clear outline. Moreover, for specific problems like kidney stones and calcification that can be seen more clearly and shows the size, shape, and position of the urinary tract. Fourth, the demonstration of kidney function can be visible in a clearer outline. And lastly, with the hematuria, lower back pain, and frequent UTI, stone infection, cancer, and traumas can be found more easily. Next, I will explain about the disadvantages. So first, there is a slight chance of getting cancer from the radiation. Second, in people with allergies, children and pregnant women, further medical treatment have to be considered. And the third one, diagnosis of acute flank pain is clearer by CT scan. That's it from me. The next part will be explained by my friend. Thank you.
Hello, my name is Shanti Dewi with my student number 142. We will talk about the clinical significance of IVP to detect urinary system disorder, firstly through this timetable. So before the invention of intravenous pyelograph, retrograde urethral catheterization was commonly used to visualize the urinary tract. though the procedure did not always succeed and safety was in question, as it could lead to complications and the result even varied, so it wasn't that dependable. So the invention of IVP in 1923 really made a big breakthrough in the study of urinary system disorder, as it can visualize kidney, bladder, and ureter with a more practical, more effective, and a lot safer procedure. So IVP used to be the gold standard for the imaging of upper urinary tract obstruction, anatomical malformation and or anomalies, neoplasms, and genitourinary tuberculosis. So as we can see from the timetable, as ultrasonography started to be used widely in the 70s for urinary system imaging and CT scanning starting from the 80s, IVP isn't used as much anymore. Because although more expensive, USG and CT scanning is a lot more time effective. They also produce better visualizations, especially CT with its multiplanar 3D reconstruction. Hence, in recent years, IVP uses have become limited, but is still an option for some special cases or situations. Thank you.
Hello, my name is Stephen Joffrey, number 161. The next is patient safety and education. Before IVP performed, there are some preparation needed to be done so the examination can be carried out without any interruption. The first is patient salt fasting at least a night before the examination. The second, the doctor may prescribe a mild laxative to empty the digestive tract. The third is the doctor should explain the procedure to the patient. The fourth, the doctor may taking history of the patient's condition such as allergies, past illness, comorbidities, and medication history. It is also important to know if the patient have a previous reaction to X-ray contrast. The fifth is the patient should inform the doctor if they are pregnant, so the doctor won't do many tests that will expose too much radiation to the fetus. The sixth is the patient has to remove jewelry or any metal accessories that may disturb the X-ray image. When the contrast is injected, the patient may feel a sting from the needle, but it is harmless and will disappear within a minute. During the examination, the radiologist may ask the patient to hold breath to avoid blurred image, ask to turn aside and hold some position to get image from several angles, and near the end, patient may be asked to empty bladder to get additional X-ray image of the bladder in the empty condition. The IVP may take 1 hour to complete, but it may take longer time as the kidney work at slower rate. After the examination finished, the radiologist will analyze the examination result and interpret it, and then send the report to the patient physician that will be discussed with the patient.
Okay, so my name is Ada Prawudina Sakti with number of 253 and I'll explain about the conclusion. So intravenous pyelography or IVP is an X-ray examination that uses iodized contrast to assess a person's urinary system, injected through the patient's veins so that it can enter the urinary system. After the contrast is inserted, the doctor can assess whether there are disturbances in the urinary system, such as in kidneys, as well as ureters and bladders. In some people condition, the IVP could cause some adverse reaction, such as hives, skin rash, metallic taste in mouth, nausea, and itching. Sometimes, severe reaction of contrast material can cause extremely low blood pressure, breathing difficulty, sudden full body allergic reaction, or anaphylactic shock, and ever worse, cardiac arrest. Intravenous program should not be considered in patients with adverse reaction to the contrast material, as it can cause unwanted anaphylactic shock. IVP is used to be the first choice for evaluation and examination, but it is safe with proper supervision. Thank you for your attention. That's all for the student project presentation.